Encephalitis is a brain condition. It's an inflammation of the brain. There are two types of encephalitis. One is infectious encephalitis and the other one is an autoimmune derivative of encephalitis where the body attacks itself in error. There are various symptoms depending on the kind of encephalitis that you have. So the infectious side of encephalitis, people present usually with flu-like symptoms, headache, sometimes nausea, changing in conscious level, and as the disease progresses, if it's not diagnosed, they can become unconscious, develop seizures, and in some severe cases can end up in a coma. With the autoimmune kind, it varies from different symptoms for various people. That kind tends to have more changes in their personality and varying neurological symptoms to do with more emotional, psychological changes in their personality. The treatment is different for both of the different kinds. So the infectious kind is treated with antiviral medicine, and the autoimmune type is treated with usually immunoglobulin therapy and high-dose steroids. So World Encephalitis Day started in 2014, so it's quite a new event, and the aim of World Encephalitis Day is to shine a light on encephalitis. So the aim is also to if you have a red light bulb in your house, to put a light bulb and light your house up red. There are various buildings across the world being lit up, and it's to raise awareness of the condition. The condition affects about 6,000 people in the UK every year and about 500,000 people globally. The disease is not as well known as meningitis or motor neuron disease, but actually the incidence is higher than both of those conditions, although they are equally devastating. There is a mortality rate associated with it, so some people can actually die of encephalitis if the longer it goes undetected, the higher the incidence of mortality. It can be as high as 70 or 80%. The mortality rate is lower the sooner you're diagnosed and the quicker you're diagnosed. So it affects everyday life in a huge variety of ways. Some people can take a long time recover and can recover to a near normal life as they were before, and some people have to, particularly patients who have been in comas, have to learn how to talk, walk, feed themselves, dress themselves. I became unwell 2 years ago in January, and I was diagnosed by the end of February. I became unwell quite quickly in January and saw many different doctors, but I believe my diagnosis came around fairly quickly and I was treated fairly quickly as well, so I consider myself very fortunate. I didn't actually present with the common noted signs and symptoms. I didn't have any headaches, I didn't feel fluey, I had changes in my personality predominantly, so I became frightened about things that didn't normally frighten me. I became vague. I had a horrific sense of nausea, dizziness, and a sense of something horrific going to happen to me, and it would pass. I also experienced déjà vu, which is common within the autoimmune encephalitis that I had. A huge sense of relief that there was definitely something wrong. It was mentioned that I could have been under stress, and that was what was making me feel the way I was. But deep inside I knew there was more to this, so it was a huge relief to actually find that there was, although it was diagnosed as encephalitis, I knew that I could be treated, and I was confident that I would be able to make a good recovery. I was admitted to Cross House Hospital and initially was treated for the infectious type because it's the most common, until some blood tests came back and a lumbar puncture test came back to say that it wasn't that kind. I was then transferred to the Southern General Hospital, to the specialist centre, and we waited 3 or 4 weeks before I got a definite diagnosis. 2 years ago the blood tests were sent to London. Now they're able to be done in Glasgow due to modern progression in medicine and testing. I had immunoglobulin treatment in the hospital, and then once I had a definite diagnosis of the type of autoimmune disease, I started on a long-term steroid course. The Encephalitis Society helped my husband probably more in the beginning than myself. He used the website. There's fantastic resources in the website. While I was waiting on my actual definitive diagnosis, because there are various kinds, he was researching that at home, and I knew that he was using a legitimate website with the correct information. They've been giving me support as well, and information, and I think for people just to have an awareness that that is there, and it's a fantastic resource. I would like people to know that although it is a devastating condition, I'm a walking example of how people can make a good recovery, to stay positive, to understand the disease. It's classed as a hidden disease. It's hidden because it affects your brain. There's no physical signs to it. It's not like a broken leg when you've got a plaster cast, or other diseases that are seen. It's in your brain, and people can't always see what's happening with you. So it's to stay positive, and I had motivation to get better. It did take 2 years. It was a long haul, but to just try and keep going and keep, being positive.